morning, APOSI peeps! Welcome back to our Wednesday Wellness webinar. So our topic for today is something to do with our liver. So it is hepatitis B. So the outline topics that we're going to discuss is definition and types, transmission and causes, signs and symptoms, prevention, diagnosis, and treatment. So what is hepatitis? So hepatitis refers to an inflammatory condition of the liver. So it is an inflammation of the liver. However, there are some causes that may lead to different types of hepatitis. So we have hepatitis A, B, C, D, and E. So we will be focusing on hepatitis B. So hepatitis B, it is a serious liver infection caused by the hepatitis B virus. So it's abbreviated as HBV. So if you have a chronic hepatitis B, so it will increase your risk of developing liver failure, liver cancer, or cirrhosis, or totally liver damage. So these are the types. We have A, B, C, D, and E. So hepatitis A, that is infection with the hepatitis A virus. So most commonly transmitted by consuming food or water contaminated by feces of a person infected with hepatitis A. Hepatitis C, it is transmitted through direct contact with infected body fluids, typically through injection, ng drug use, and sexual contact. So, ito yung common sa blood-borne viral infection. Now, hepatitis D or the Delta hepatitis, so it is a serious liver disease wherein it is contracted through direct contact with infected blood. And it is a rare form kasi nga it only occurs in conjunction with hepatitis B infection. So this virus can't multiply without the presence of hepatitis B. So interrelated sila with hepatitis B. Hepatitis E, so it is a waterborne disease by the hepatitis E virus, and it's mainly found in areas with poor sanitation and typically results from ingesting fecal matter that contaminates the water supply. So sa tubig siya, waterborne yung type E. So what are the transmission, how it will be transmitted? So of course, infectious body fluids such as blood, vaginal secretions or semen, and then unprotected sex, and then infected woman to her newborn during pregnancy or childbirth. So pag yung buntis, positive siya sa hepatitis B and nanganak siya, pwedeng maipasa yun sa baby. And then use of illegal drugs and sterilized or contaminated needles. So sa mga drug addicts, they are used to have one needle lang. So lahat na ng tao. So kapag may hepatitis, then that would be transmitted to other person. So what are the signs and symptoms? So yellowing skin and eyes, dark urine, light-colored stools. Bakit? Ganon yung signs and symptoms. It's because liver, if you can still remember the function of the liver, liver kasi natin, it creates the color of our sweat, our urine, our stools. So kapag may problema yung liver natin, so ganyan yung mangyayari sa atin, lalabas yung yellowish color sa skin. So it's called jaundice naman. And then we have nausea and vomiting, loss of appetite, and then extreme fatigue. And sometimes the patient will experience fever. So parang konting trangkaso lang siya. The difference is magkakaroon ka ng yellowish skin and yung color ng, ng urine mo, it's not yung yellowish. So parang sobrang dark siya na color ng urine, and then yung stool mo wala siyang color. It's because yung liver mo is malfunctioning. So what are the prevention that we can do in order to not to get hepatitis B? So according to CDC, so the best way to prevent hepatitis B is vaccination. So nung mga bata pa tayo, we have hepatitis B vaccination. or minsan hepatitis na siya diretso para at least if we will have or ma-protect tayo of getting hepatitis. And then aside from the vaccination, we can also do healthy habits such as do not inject drugs. Now if nag-i-inject ng drugs, kailangan do not share the needles. And then do not share also your personal care items that might have blood on them. So such as mga razors, mga ginagamit natin ng mga for personal hygienes, do not let other people use it. And then instruments should be properly sterilized that will be used in tattooing, body piercing, or acupuncture. So if you are fond of having a tattoo, then you have to make it sure na yung needles na ginagamit, it should be properly sterilized. And then of course, you have to practice safe sex by using condom. It's because for the transmission, yung mga secretions from the vagina and semen, it could be a source of transmission. So how it will be diagnosed? So of course, the doctor will get your medical history and it will conduct any physical exam and then liver function tests. So these are laboratory tests that you have to undergo and then blood tests. For autoimmune hepatitis, ibig sabihin bigla lang nagkaroon ng inflammation on your liver. So blood tests will be used and then the liver ultrasound and liver biopsy. So liver function test and liver ultrasound, it will measure the damage of your liver. Now, ang liver biopsy naman, it will also check if gaano na lang kanipis or kakapal ba yung liver mo or gaano din ka-damage yung liver mo and then kukuha yan ng maliit lang na sample of your liver and then it will undergo a series of tests to make it sure that you have a hepatitis B. And then what are the treatments? So for the treatment, we have three. So of course, antiviral medications kasi nga Hep B is a virus. And then it will help to fight the virus and it slows the ability to damage the liver. Yun yung function na antiviral medications. Now, yung medication na yan, it will be coming from your doctor and it is not over-the-counter drugs. So, yung mga diagnostic test na mention ka kanina, you will undergo that one. And then next is interferon injections. So, it is a man-made version of some substance produced by the body to fight injection. So, patients who doesn't want to have a long-term treatment of hepatitis B treatment, then they will going to avail the interferon injections or sometimes yung mga mothers or mga ladies na gustong mabuntis after getting a series of or completing a routine therapy, then they will get interferon and injections. Now, if your liver naman is severely damaged na talaga and it's not really functioning well, the last option would be liver transplant. So the surgeon will remove a part of your liver kung saan lang yung damage and then papalitan siya ng healthier liver. So yung liver na yon it's either coming from a healthy person or a disease. So may mga series din naman na test and compatibility test na yung liver mo is yung itatransplant na liver sa'yo will not be rejected by your body kasi kapag nag-reject yon may mga series of complications din yon. Okay. If you find yourself having those signs and symptoms, then it would be better you will consult the doctor. It's because they will be the one to assess and diagnose you properly and we will not think of anong mga sakit-sakit na meron tayo. And for the next week's topic, that would be diabetes mellitus. That would be our topic for next week. If you will know someone having those concerns about diabetes, then you can invite them freely for next week. So if you don't have any questions or concerns, then you can just simply message us to APOSI Clinic team. And thank you for your time, guys. Have a great day. Bye!